Hello, my name is Kusum Viswanathan and I'm here to tell you a little bit about sickle cell disease in the newborn. You've probably been told that your baby has sickle cell disease, either SS, SC or sickle thalassemia, and various emotions are probably going through your head. You are shocked, there's anger, and most of all, parents are scared. You're scared because you don't know what are the things that can happen to a baby with sickle cell disease. Let me tell you a few things that can happen to babies with sickle cell disease, because it is very important for a parent to be educated, to know what the disease is, what to look for, and how they can deal with it. Sickle cell disease is a condition where the red blood cells, instead of being a normal donut shape, are sickle shaped. So there are two important things that happen. One is that the red cells break up easily, so they get what is known as hemolysis. So the red blood cells goes down in number and the patient is anemic. The other thing that can happen is the red cells, which are sickle shaped, are very sticky and they stick to the blood vessels and block blood vessels, resulting in reduction of blood flow to certain parts of the body, causing different kinds of vaso-occlusive crisis, which is really blockage of blood to certain parts of the body. The important things that can happen to a baby with sickle cell disease and that every parent should know about are: number one, hand-foot syndrome. Hand-foot syndrome is swelling of the hands and feet of the baby. It could be one hand or it could be both hands or it could be both feet. And it can occur suddenly and it's painful. You will find that the baby will suddenly not use that hand as much and will cry whenever the hand is touched. When this happens, it's important to put warm packs and also give the baby medicine for pain like Tylenol or ibuprofen, and you would speak to your doctor about that. It is also important to make sure that the baby did not get hurt, and this is not a swelling because the baby got hurt. Babies can get hand-foot syndrome when they are exposed to extreme cold. So it's very important that in winter months you keep your baby well covered. Babies can also get hand-foot syndrome when they are dehydrated. So it is important to keep your baby well hydrated at all times.
Good boy. Thank you.
The spleen is an organ that is on the left side of the belly, under the rib cage. In most babies, it is not felt. But in babies with sickle cell disease, the spleen can be a little enlarged. What really happens is the spleen acts like a bag, and the blood in the body goes into the spleen, and this complication is called splenic sequestration. So we say that the spleen sequesters the blood, and the blood goes away from the baby's body. So the baby gets very anemic, and this can lead to shock, where the blood pressure goes down. So if at any time you feel that the baby looks very pale or tired or lethargic, or you think the spleen may be enlarged, it is important to seek immediate medical attention. So when you come and see the doctor, we usually show you how to feel for the spleen. And you feel for the spleen, and you should always know what is the normal size of the spleen in your baby. Make it a routine habit to feel for the spleen every time you bathe your baby. If at any time the spleen looks enlarged or has suddenly increased in size, then it is important for you to immediately call the center, or if you cannot reach anyone, you come to the emergency room. When you are in the emergency room, you should always tell the staff that your baby has sickle cell disease and the spleen is suddenly big and your baby needs to be seen right away. Another complication that can happen is fever. Fever can occur in all babies who do not even have sickle cell disease. But when fever occurs in a baby with sickle cell disease, we take it very seriously, because babies with sickle cell disease are somehow not able to handle infections as well as other babies. So it is important for everyone to have a thermometer in the house and know how to take a temperature. It is important to immediately call your sickle cell center or the pediatrician, and if you cannot reach either one of them, you go to the emergency room, and in the emergency room you tell the physician or the nurse in triage that your baby has sickle cell disease and has fever and should be seen right away. In the emergency room, they will examine your baby, do blood tests and urine tests, and give your baby a dose of antibiotics. This is very important for babies with sickle cell disease, because if you don't get antibiotics right away and there is truly a bacterial infection, the baby can get meningitis. So it is very important to be very proactive. He's gotten all his immunizations.
Everything's up to date.
It's really good. All the standard immunizations that all babies get should be received by a baby with sickle cell disease, which also includes the Prevnar vaccine, which is for pneumococcal infections, and that is given at age 2, 4, and 6 months. But in addition, babies with sickle cell disease will also get a special pneumococcal vaccine called pneumococcal polysaccharide vaccine, which has 23 antigens, which is given at age 2 and at age 5. We also make sure that you give the baby some medication to prevent infections. We prescribe penicillin, which is given twice a day, and the dose is 125 milligrams twice a day in babies from 2 months to 2 years. And after the age of 2 up until the age of 5, we give 250 milligrams twice a day. We also give a medication called folic acid, which is a vitamin, which is given because the baby's blood cells break up so much. It is important to replenish the folic acid, which is used while making red cells. So that's a small tablet that can be crushed and given to the baby daily. When the baby is under 2 years of age, we make sure you understand all the precautions that we talked about. We teach you about spleen palpation, teach you how to take a temperature, and answer any questions that you might have. We encourage you to join our sickle cell parent support group, which is a great way to understand what babies with sickle cell disease can get. It is also a wonderful way to link up with other parents who are actually going through exactly what you're going through. When you come to see us and the baby is 2 years of age, we start looking for other complications of sickle cell disease, and we start doing tests that we didn't do before the age of 2. So in addition to the blood tests that we do, we also do a test called a transcranial Doppler, which is a test which checks the blood flow in the brain. We do cardiology tests, checking the functions of the heart. We look at the baby's lung function tests, and we can also do an MRI and an MRA of the brain to see if the brain is doing fine. And these are just tests done to make sure we look for problems before they occur. It is very important for you, the parent, to establish a relationship with the sickle cell program. This way you will feel comfortable calling them at any time or using the emergency beeper to call at any time. Here are a few questions the doctor might ask you when you call them or beep them in an emergency. They would ask you, is there any fever? Have you given any medicines for the fever? Is there any pain? Have you given medications for the pain, and what were they? Is there any swelling on any part of the body? Is the child able to walk and communicate, or is the child not able to move the limbs? Is there any vomiting, and is the baby able to keep down fluids? I encourage you to call the Comprehensive Sickle Cell Program if you have any questions at any time. I hope I have helped you understand the complications of sickle cell disease. I encourage you to inform all caregivers of the baby about these complications so everyone who is with the baby understands what to look for. But most of all, I want you to enjoy your baby. Thank you.